Hey everyone, my name's Brom, and welcome to this week's episode of the Integration Conversation. The Integration Conversation is the podcast where I use my 7 years of experience as a portfolio manager at a hedge fund to analyze the emerging psychedelics industry from a business and investing perspective. And in this week's episode, I'm going to be going over some of the foundational elements of what psychedelic medicine is. Most of the content on this podcast so far has focused on specific companies, kind of going over the different business components of what the psychedelic industry will eventually need in order to fulfill its promise of providing healthcare to the 20% of Americans that are currently suffering from some sort of mental issue. But I sort of realized that I've never actually covered what psychedelic medicine is, how it works, and what sort of results we're seeing in clinical trials. And so sometimes I'll be talking to people and I'll be talking about this company that is delivering psychedelic therapy and how much potential this company has. And then they'll say, well, that's great, but what exactly is psychedelic therapy? And so if you're someone who's already familiar with psychedelic therapy, how it works, and if you're already familiar with all the research that's been done on psychedelic therapy, this might be an episode that's not that interesting to you. But it is going to be a little bit different than the normal content that I put out. But if you're someone who's new to this space, you're curious about investing in psychedelics, but you're not quite sure exactly what this medicine is, and you're not quite sure exactly what sort of promise it shows in treating issues like PTSD and depression compared to, the current available treatments, then I think that this episode will be informative for you. I'll also say that, this Integration Conversation program exists as both a YouTube channel and a podcast. And normally I don't really do much with the YouTube channel other than just have a video of my face talking. So there's not much lost if you listen to the audio only version. But in this week's episode, I'm going to be showing some charts that are taken from clinical trial papers. So if you're listening on the audio, there are going to be some times where you're going to be hearing me describe things that are on screen, and it might be beneficial to you to just go and pop up the YouTube video so that you can actually see the charts that I'm talking about. And these charts are very interesting. They show dramatic changes in all sorts of different mental health metrics when taken pre-psychedelic experience and post-psychedelic experience. So once again, this episode is going to be 2 parts. First, we're going to describe what exactly psychedelic therapy is and the different stages of it. And then I'm going to go through 3 very compelling clinical trials that I personally think are some of the most compelling clinical trials and have some of the most compelling visual charts that I think really can very quickly convince someone that psychedelic medicine is a very powerful tool for change and for improving mental health outcomes. So we're going to get into all that in just a second. First, I want to say, like and subscribe to the YouTube channel. If you're listening to the podcast, please, subscribe to the podcast on whatever podcast application you use, whether it's Apple Podcasts, Spotify, Pocket Casts, whatever. Leave a review in iTunes. All that stuff really helps make this program grow and reach new listeners and spread, the message of psychedelics and make people aware of the fact that psychedelics are actually, a real industry that is emerging and is going to be a real important part of the mental health care landscape going forward. You can also follow me, Brom, on Twitter at @TheRealBrom. And we also have an Instagram page for the show. It's The Integration Co. The Integration Conversation was a little too long. So the Instagram handle is just The Integration Co. I post a lot of clips from the podcast. I post a lot of short little thoughts related to psychedelics that I don't necessarily touch on the show. So you definitely want to follow both me on Twitter and on the Instagram. And, I think with all that out of the way, I think we should just get right into talking about what exactly psychedelic medicine is. So let's talk about psychedelic medicine. Psychedelic medicine is usually divided up into 2 large categories. There's psychedelic therapy and there's microdosing. Now, microdosing is very popular in the sort of underground psychedelic community, but the truth is that microdosing just hasn't been studied in a clinical fashion to the same extent that psychedelic therapy has. So sure, while there is lots of anecdotal evidence suggesting that microdosing might be, a big deal in the future, it just hasn't had a lot of studies done on it. And it's not close to being approved by the FDA, whereas psychedelic therapy is. And so this video is going to focus mostly on psychedelic therapy, but you should be aware that there's this idea of microdosing, which is where you take small, non-psychoactive amounts of psychedelics on a regular, usually daily basis in order to improve creativity, happiness, openness, that sort of thing. But again, all of that is hasn't been studied to the same extent that psychedelic therapy has. So we're going to focus on psychedelic therapy. So what exactly is psychedelic therapy? Now, psychedelic therapy is, as the name sort of suggests, the use of psychedelics in concert with a therapist to treat, everything from depression to anxiety to post-traumatic stress disorder. And psychedelic therapy usually takes place in 3 stages. So the first stage is sort of the preparation phase, and this is where the patient meets with the therapist. The therapist does, a couple of therapy sessions with the patient in order to identify what the issues the patient is having are. So they may need to get a diagnosis of, do they have depression? Do they have PTSD? Do they have anxiety? Do they have a combination of the 3? And then the patient, of course, is going to decide on the right therapeutic protocol, and this could include the exact drug taken, the number of psychedelic sessions the patient may need, so on and so forth. And of course, in this pre-psychedelic experience prep work time, the therapist also might describe what psychedelic experiences are like in case the patient has never, encountered psychedelics before. This can be a very scary thing. And so the therapist will usually do a lot of talking through what to expect and, how to handle some of the things that can happen during a psychedelic experience with the patient. But once all that's out of the way, the second phase of psychedelic therapy is, of course, the psychedelic experience. And this is where the patient consumes some sort of psychoactive or psychedelic drug, rather. This could be MDMA, this could be Psilocybin. Those are the 2 that have been studied the most, but there are other clinical trials underway for LSD, for Ibogaine, for DMT. And usually, although the protocols sort of vary depending on what study you look at, the therapist is present during these sessions, but the patient is kind of in their own world. They're laying on a couch. They might have a blindfold on. They might have headphones on listening to music. It's not like the therapist is really talking to them while they are under the influence of the psychedelic drug. Usually the therapist is just kind of there to make sure that everything is going okay and to make sure that if the patient needs something, they know that there's someone there that can help them out. But it's not like some sort of shamanic ritual where there's, someone kind of chanting or telling the person to do something or hitting them on the head with some stick or something. It's just the patient is there consuming the psychedelics, and the therapist is kind of standing by, maybe holding their hand if they're going through a difficult moment, but mostly letting the drug do the work. Now, of course, if you're not familiar with psychedelic drugs, usually the idea is that there is increased neuron activity in the brain, increased neural connections, and this can cause a lot of very interesting things to happen to the patient while they are under the influence of the psychedelic drug. So very commonly, when we're talking about a drug like MDMA, for example, maybe we're talking about a patient who has PTSD from some sort of traumatic event. Maybe it's childhood abuse. Maybe they were a soldier in a combat zone that saw a lot of people die. Could have been just someone who was involved in some deadly accident and they were the only one surviving. A lot of times these memories get repressed and hidden away, and they're not ever dealt with. And this is what causes post-traumatic stress disorder. While these drugs, they will oftentimes bring these issues that have been long repressed to the surface. And that sounds bad, but you have to understand the way in which these memories are often brought to the surface. So the psychedelic experience, normally what happens is these memories will be brought to the surface, and the patient is able to sort of observe them in a detached, objective, non-judgmental way, which is very different from when you normally just remember some traumatic event. Usually you remember the traumatic event and you freak out and you try to shove it back down as quickly as possible. But under the influence of psychedelics, these memories, they will come up, and it's almost like they're not even your memories. They're just, it's like you're standing outside of the situation and you're seeing your memories, you're seeing yourself, and you're seeing how you're interacting with these memories. And patients often report being able to interact with these memories with a feeling of acceptance and sort of forgiveness, which is something that is very difficult to do normally. Another thing that very commonly happens is that unhealthy habits that the patient has that maybe they've been rationalizing away. An obvious example might be smoking cigarettes or, consuming excess alcohol on a regular basis, but it could also be, some unhealthy mental habit, constantly criticizing others or something else. If you have unhealthy behaviors that you've been rationalizing away, oftentimes the psychedelic drug or the psychedelic experience will reveal these things to you, stripped of all their rationalizations, and make you sort of realize what you are doing to yourself and to those around you with those unhealthy habits. Patients often also report irrational fears and anxieties being shown for what they really are, which is usually not as the patient has built them up in their mind to be. And so something that a patient is irrationally afraid of or irrationally anxious about, and it just doesn't seem like there's possibly any way that, they could think anything else about these things, the patient now all of a sudden feels that these fears or these anxieties are overcomable, that the patient is able to, maybe do something about them. And one of the more intense things that will often happen is that all of these things that I was just describing, whether it's the repressed memories, whether it's the unhealthy habits that have been rationalized away, or whether it's the irrational fears and anxieties that the patient is sort of recognizes now are irrational, the patient will sort of see these possible futures, and these possible futures can be positive or negative. In the negative sense, they will see what is the conclusion of continuing to not deal with these repressed memories or continue to do these unhealthy habits. What does my life look like 20 years from now if I keep this up? Like the psychedelic drugs seem to have a way of showing you what that path might look like and how dark it may be. And then on the other hand, you will often be shown visions of a future where you've actually dealt with these problems and, you're able to see that you now have this positive future because you have dealt with these things. And as the psychedelic drug leaves the body, the patients have this tendency to come back to reality, feeling renewed, feeling refreshed, and able to, face their issues and fears. And most importantly, they feel that facing them and making changes is something that is actually within their power now, where oftentimes prior to the psychedelic experience, it just doesn't seem like you have a shot at being able to do anything about these things. And that's what makes the psychedelic experience so powerful from the perspective of a patient. Now, it's still a matter of some debate what exactly is happening behind the scenes to enable this change, to enable these thoughts. But the basic idea is that there are increased neural connections in the brain, and even past the psychedelic experience, there is increased neuroplasticity, which makes it much easier to form new habits, whether we're talking about thinking patterns or actual physical behaviors, than it would be without the psychedelic experience. And so coming out of the psychedelic experience, you really do have this shot at making a change in your outlook or your physical habits for the better. Now, I know that Joe Rogan is somewhat of a controversial figure, and I don't know that anyone should listen to him as some sort of authority on psychedelics, but he has this quote that he said on a couple of his podcasts that I always find pretty accurate, at least in my own experience. He says, coming out of a psychedelic experience is as if you took all of those crazy icons and scattered folders on your desktop that were, clogging it up, and you drag all of them and you put them into a single folder and you reboot your computer. So now you have this freshly rebooted computer, and the desktop has been replaced with a single folder that's called My Old Bullshit. Now, of course, it's sort of up to the patient whether they're going to delete that folder or whether they're going to open it up again and go back to those old unhealthy habits. And this is where the third step of psychedelic therapy, which is called the post-psychedelic integration session, is so important. And as you can probably guess, this is where the title of this podcast comes from, this idea of integration, which is where the patient will work with the therapist or the psychedelic guide to integrate the lessons learned during the psychedelic experience into their lives going forward. And I think when people hear about this initially, their gut reaction is sort of like, well, that sort of sounds like a nice optional step. I think it's maybe just all about the psychedelic part. But there has been research that has suggested that if you are actually trying to use psychedelics as a tool for change, this integration therapy is absolutely critical. And in fact, I believe MAPS did one study where, at least with MDMA, they showed that if you compare psychedelics therapy and psychedelics plus therapy, psychedelics plus the integration therapy was the best thing. And people that love psychedelics might guess that psychedelics by themselves were the next best thing. But actually, therapy by itself was the next best thing. And then psychedelics by themselves were sort of last place. So without therapy, psychedelics as a tool for change are not necessarily so effective. It's much better to have someone helping you through this experience, and it's much better for your like long-term prospects of actually keeping those, implementing those things that you learned during the psychedelic experience into your life going forward. And so when you hear about these clinics that are going to perform psychedelic therapy, it's important to understand that they're not just going to be putting people in rooms and giving them psychedelics. In fact, I would say about 75% of the therapy sessions that will take place in any of these clinics will be non-psychedelic therapy. And then, there will be some ratio of maybe 1 psychedelic experience to 3 therapy sessions. That's something you commonly see in the trials. Like the therapist will meet with the patient the day after the psychedelic experience, at the 1 week mark, and then at the 1 month mark, or sometimes at the 6 month mark, just to really help make sure that the patient is sort of keeping to, really like implementing those lessons. So that's how psychedelic therapy works. You have the pre-session work, you have the psychedelic experience, and then you have the post-psychedelic experience integration therapy, which helps solidify all that cool stuff that you learned about yourself during the psychedelic experience. So now we're going to talk about some of the research that has happened in psychedelics, and I'm going to show you about 3 different clinical trials that I think are particularly compelling. I will have links to other clinical trials in the show notes that you can go and check out. There's been tons of research done, but the 3 studies that I'm going to show you today, I think are particularly impactful to me. And this is where, if you're listening on the podcast, you might want to check out the YouTube video because I'm going to throw up some screenshots and charts. And the first study that we're going to talk about is from MAPS, which is the nonprofit organization that sort of started this whole psychedelic renaissance. And they are the only organization that has a phase 3 clinical trial with the FDA. And their therapeutic trial that they're working on it's called MDMA assisted therapy for severe PTSD, a randomized, double-blind, placebo-controlled phase 3 study. So, of course, as you probably know, PTSD is post-traumatic stress disorder, comes from childhood trauma, veterans in combat zones, people involved in deadly accidents, that sort of thing. And I'm going to get into, what I think is interesting about this study, but I am first just going to read the abstract from the study so you can sort of see what they say about it. Here's the abstract. Post-traumatic stress disorder presents a major public health problem for which currently available treatments are only modestly effective. We report the findings of a randomized, double-blind, placebo-controlled, multi-site phase 3 clinical trial to test the efficacy and safety of MDMA-assisted therapy for the treatments of patients with severe PTSD, including those with common comorbidities such as dissociation, depression, a history of alcohol and substance use disorders, and childhood trauma. After psychiatric medication washout, 90 participants were randomized to receive manualized therapy with MDMA or with a placebo, combined with 3 preparatory and 9 integrative therapy sessions. So remember, just a second ago, we were talking about how it's not just about the psychedelic experience. You have the prep sessions, and then you have the integration therapy. So here it says they had 3 preparatory sessions and 9 integrative therapy sessions. PTSD symptoms measured with the clinician-administered PTSD scale for the DSM-5. It's called the CAPS-5, which is the primary way that people evaluate the severity of someone's PTSD diagnosis. And functional impairment measured with the Sheehan Disability Scale, which is the SDS. This is like a secondary metric. And this is sort of like, okay, you have PTSD. How much is it impacting you in your day-to-day life? How disabled are you from this PTSD? They were assessed at baseline and at 2 months after the last experimental session. Adverse events and suicidality were tracked throughout the study. MDMA was found to induce significant and robust attenuation in the CAPS-5 score compared with placebo. Remember, the CAPS-5 score is the PTSD metric, basically. The mean change in the CAPS-5 scores in participants completing treatment was minus 24. So they lost 24 points of PTSD severity in the MDMA group and 13 points in the placebo group. So people that received just therapy lost 13 points on the PTSD scale, and people that had MDMA plus the therapy lost 24 points on the PTSD scale. So this is sort of showing that the PTSD group recovered twice as many points, basically. MDMA, this is very important because side effects are a big deal, right? MDMA did not induce adverse effects of abuse potential, suicidality, or QT prolongation. So it didn't cause anyone to commit suicide. There did not seem to be any potential for abuse of MDMA, and whatever QT prolongation is did not happen. These data indicate that compared with manualized therapy with inactive placebos, MDMA-assisted therapy is highly efficacious in individuals with severe PTSD, and treatment is safe and well tolerated even in those with comorbidities. We conclude that MDMA-assisted therapy represents a potential breakthrough treatment that merits expedited clinical evaluation. And this is why the FDA has granted this study breakthrough therapy designation, which is, kind of an expedited clinical evaluation pathway through the FDA. And I want to go to what I think is the most impactful chart from this study. So I'm going to break down what this shows here. So on the left, we have the placebo group. Those are the 3 blue columns. And on the right, we have the MDMA-assisted therapy group. Those are the 3 red columns. And I think the most impactful thing for me is looking at the percentage of participants that achieved remission. So remission is indicated by the darkest shade of blue on the left and the darkest shade of red on the right. Now, if you look on the left at the placebo group, you will see that even after 3 MDMA sessions, only about 4 or 5% of the participants achieved remission of their PTSD symptoms. But if you look at the right, after 3 sessions, almost 30% of the participants achieved PTSD remission, which is really, this is really unbelievable. And, PTSD, they mentioned it in the abstract, but PTSD is something that is very difficult to treat. There are a lot of treatments out there for depression and anxiety that do work for quite a few people, even though they have kind of ugly side effects. But PTSD doesn't really have very good treatments. Therapy is kind of the only hope. And as we see here, looking at this placebo chart, in the placebo group, only about 5% of patients achieved remission, whereas almost 30% of patients achieved remission when you included the MDMA with that therapy. So it's really amazing going from only about 5% of the patients achieving remission without MDMA to almost 30% achieving remission with MDMA. And of course, you can analyze the rest of the numbers in this slide as well. But I think that what we covered already gives you a pretty good idea of just how powerful the addition of a psychedelic substance with therapy can be. So next I want to talk about psilocybin. Psilocybin, of course, is the active ingredient in magic mushrooms, and psilocybin has shown great potential in many different clinical trials for treating depression. In fact, there are 2 clinical trials with the FDA in phase 2 that have both been granted breakthrough therapy designation that are focused on treating different forms of depression using psilocybin-assisted therapy. Now, this study looked at using psilocybin to treat depression and anxiety with patients that have a very real reason to be depressed or anxious, and that is because they have been diagnosed with life-threatening cancer. And so what they did in the study, Matthew Johnson and his associates, they gave patients that had been diagnosed with cancer and were showing depression and anxious symptoms psilocybin, and then they monitored them 6 months later. And the interesting thing about this study is that they not only did 1 or 2 different tests for depression or anxiety, they actually administered 9 different surveys that are used to track depression and anxious symptoms. And when you look at the results, it's such a beautiful thing because you see that psilocybin produced serious changes across all 9 of these mental health metrics. And I'm going to show that slide in a second. First, I just want to talk a little bit in detail about what happened here. So I'm just going to read the abstract, just like I did with the MDMA study. It says, cancer patients often develop chronic, clinically significant symptoms of depression and anxiety. Previous studies suggest that psilocybin may decrease depression and anxiety in cancer patients. The effects of psilocybin were studied in 51 cancer patients with life-threatening diagnosis of symptoms of depression and or anxiety. This randomized, double-blind, crossover trial investigated the effects of a very low placebo-like dose versus a high dose of psilocybin administered in counterbalance sequence with 5 weeks between sessions and a 6-month follow-up. Instructions to participants and staff minimized expectancy effects. Participants, staff, and community observers rated participant moods, attitudes, and behaviors throughout the study. High doses of psilocybin produced large decreases in clinician and self-rated measures of depressed mood and anxiety, along with increases in quality of life, life meaning, optimism, and decreases in death anxiety. At 6-month follow-up, these changes were sustained, with about 80% of participants continuing to show clinically significant decreases in depressed mood and anxiety. Participants attributed improvements in attitudes about life, self, mood, relationships, and spirituality to the high-dose psilocybin experience, with 80% of the patients endorsing moderately or greater increased well-being, life satisfaction. Community observer ratings showed corresponding changes. So let's look at the results here. And this, honestly, I'm going to zoom in a little bit because it's kind of hard to see. This chart, honestly, I don't mean to be dramatic, but it almost like makes me cry in a way, because what we see here is dramatic changes in 9 different mental health metrics. So the grid HAM-D depression score you see right there, and the blue and red lines, by the way, the blue line are the people that had the placebo dose first, and the red line are the people that had the high dose first. So basically what you'll see throughout this chart is that it kind of didn't matter if you had the placebo first or the real thing first, you still had very impressive changes in these metrics 6 months later. The Beck depression inventory, massive decrease, down from about 18 starting to 6 or 7. So Beck depression inventory cut in half in both groups. The HADS depression metric going from about 10 to about 5. So again, getting cut in half. The HAM-A anxiety metric going from about 25 pre-psilocybin to about a 6. So that's getting cut by almost 4, divided by 4. The STAI trait anxiety metric going from about a 47 down to about a 35. The POMS total mood disturbance metric going from about a 50, 60 down to about 20, 30. That again, about cut in half by the psilocybin. The brief symptom inventory, again, going from 40 down to about 20 to 30. So pretty significant increase there. The McGill quality of life index going from about 5.5 all the way up to about 7 or 8. So nearly doubling quality of life metric. And this particularly important for people that are diagnosed with life-threatening cancer, the death acceptance score going from about 30 to, about 36, 37. So a real change there. And I think that it's just amazing to see that these changes were sustained, not for just a couple days after the psilocybin experience, but for 6 months after. And the idea that, a single real dose of this substance, the idea that this can produce a sustained change like this is really unbelievable. I mean, any other antidepressant, any SSRI, you have to take it every single day. It's giving you side effects. But this, that you take one dose, and for at least 6 months, I'm sure if they had ran this study for even longer, you would have still seen some, some sustained improvement. But for at least 6 months, your mood is dramatically improved, depending on the metric you look at, sometimes by more than 50% from a single day's psychedelic experience. Is really just amazing. And these are people, remember, that have life-threatening cancer. So I don't know, this study particularly impactful to me. And the second study that I think I want to look at for psilocybin is we've seen here with this study that psilocybin is useful at treating depression, but one question that you might ask is, well, how is this better than the existing methods? And it turns out that this has been studied as well. So there's a great study in the New England Journal of Medicine called Trial of Psilocybin versus Escitalopram for depression. And Escitalopram, which I'm probably pronouncing incorrectly, is the chemical name for Lexapro, which is one of the most commonly prescribed SSRI antidepressants on the market. So this is a good, example of like how people are normally treated for depression. And if you're not familiar with like what an SSRI is, SSRI stands for selective serotonin reuptake inhibitor. This is what Prozac, Lexapro, most antidepressant medications that your doctor might prescribe to you are. And, SSRIs, I don't want to say they don't work, because they do work for many people, but about a third of patients do not respond to them. So about a third of patients take SSRIs and like nothing happens. So that's not good. And then for the people that they do work for, they often have very unpleasant side effects, including sexual dysfunction and weight gain, which are certainly not things that you want to have happen to you, very bad as side effects go. So, and of course, you have to take them every day, right? There's something that you have to take every single day. And my understanding is that about 1/3 of people who stop taking SSRIs become depressed again somewhat quickly. So they don't cause like a permanent change like we saw with psilocybin, where you take that single dose and for 6 months you're feeling much better. So again, the idea isn't that SSRIs don't necessarily improve mood. It's that they don't necessarily work for everyone. They have very ugly side effects often, and they don't really create any permanent changes in many people, because about a third of people go back to being depressed after getting off this SSRIs. So as I did with the last two studies, I will read the abstract of this. It says, psilocybin may have antidepressant properties, but direct comparisons between psilocybin and established treatments for depression are lacking. So, in a phase 2 double-blind randomized controlled trial involving patients with long-standing moderate to severe major depressive disorder, we compared psilocybin with Escitalopram, a selective serotonin reuptake inhibitor, over a 6-week period. Patients were assigned in a 1-to-1 ratio to receive 2 separate doses of 25 milligrams of psilocybin 3 weeks apart, plus 6 weeks of daily placebo. This is the psilocybin group, or 2 separate doses of 1 milligram of psilocybin 3 weeks apart, plus 6 weeks of daily oral Escitalopram. So basically, you didn't know, you still had to take like these 2 doses of some other pill 3 weeks apart. In half the people, that was a real dose of psilocybin, 25 milligrams. And the other group that was given the real Lexapro, it was a 1 milligram of psilocybin, which is not enough to do anything. All of the patients received psychological support. That's the therapy component, remember, because therapy is important here. And the primary outcome was the change from baseline in the score on the 16-item quick inventory of depressive symptomology, the QIDS SR16. The interesting chart from here, I'm about to pull up. And this I think really kind of sums it up. So here are the 16 metrics, and you'll see that they're grouped into both positive items and negative items. The positive items are things like ability to cry, ability to feel compassion, creative feelings, feelings of pleasure, ability to concentrate, ability to feel intense emotion. And what you'll see is that in both the psilocybin, and by the way, these numbers that you're seeing here are changes after 6 weeks compared to what the patients scored prior to starting this study. So what you'll see is that both the psilocybin group and the Lexapro group have positive changes to the positive items. So the idea here is that both psilocybin and Lexapro did, increase these positive feelings. But what you will sort of notice here is that if you look at the actual numbers in the psilocybin group, they are on average a little higher than what you see in the Lexapro group. But both drugs are moving people in the right direction when it comes to the positive items. But this second section, the negative items, this is where the difference between psilocybin and these SSRIs really starts to shine. So negative items like a problematic restlessness, feeling manic, feeling paranoid, having headaches, gut problems, nausea, sweating, dry mouth, drowsiness, these are of course, bad side effects. And what you'll see is that in the Lexapro group, almost with the exception of restlessness, all of these scores for these items increased. So Lexapro increased headaches. Lexapro increased gut problems like diarrhea. Lexapro increased drowsiness and dry mouth and sweating. It increased, feelings of mania. Not good stuff. But if you look at psilocybin actually did the opposite. So it's not like psilocybin just kept you at your baseline. Psilocybin actually improved all of these negative items as well. So after 6 weeks after your therapy with psilocybin, you were actually less paranoid than you were before you started treatment. You were less drowsy. You had less problematic restlessness. Almost all of these negative feelings decreased relative to your baseline if you were part of the psilocybin group. And this right here, in addition to, of course, the other big thing, which is that you don't have to take this drug every day, right? It's, spaced out every couple of weeks, every couple of months. You literally have like no increases in any of these negative side effects here, which I think is just, it's something that the current existing way that we treat depression with SSRIs can't even pretend to give you, right? Psilocybin is fixing the depression and like causing improvements on all these other metrics, which Lexapro and SSRIs are increasing. So it seems, very clear cut that psilocybin represents a serious improvement over the way that we currently treat depression. So those are 3 studies that I find particularly impactful, but this just begins to scratch the surface of the promise of psychedelic medicine. This doesn't start to look at the studies that have been done on psilocybin for smoking cessation, the studies on Ibogaine for getting rid of opioid dependence. There are so many studies out there on molecules ranging from LSD to DMT to Ibogaine to psilocybin to MDMA, covering like all sorts of, issues, everything from PTSD and depression, which we already talked about, to things like eating disorders and weight loss and, substance abuse disorder. So I really recommend that you check out some of the links in the description and, go down this rabbit hole yourself and see what studies are currently being done and, see for yourself the promise that psychedelic medicine has for, the future of mental health care. I think that just about does it for this episode. Stay tuned. Next week, I'm going to have some interviews. We got some interviews with people from some publicly traded psychedelic companies that should be released this coming week. Very excited for those. And as always, like and subscribe to the channel. Follow us on Instagram at The Integration Co. Follow me on Twitter at The Real Brom. And I'll see you next time.